Welcome on this discussion of how to enhance conversations when the person you care about has communication deficits. I'm Joanne Winckel. I'm a speech language pathologist at the Aphasia Center of Ottawa. And my co-presenter is?
I'm Karen Mallet, speech language pathologist on the best practice team with the Champlain Regional Stroke Network. So today we're going to present on enhancing conversations when the person you care about has communication deficits. So what can you do to improve conversations? We're going to talk about when the person has a dysarthria. We can ask them to slow down. We can ask them to exaggerate their articulation, take more frequent breaths, and write down key words. Some general strategies that can be used to enhance communication are: use a respectful and adult tone of voice. Give the person your full attention. Do not talk too quickly. Be patient. This means give them the time that they need to communicate. We want to match our verbal with our nonverbal. We don't want to yell. We want to use humor, so share the joke. Assume they understand more than they can tell you, and be honest. Some strategies for difficulties with understanding. We want to acknowledge their difficulties. Can the person hear and see you? We want to reduce background noises, reduce distractions. We want to use gestures. You can ask yes and no questions. Use pictures and objects, and write keywords. Some more strategies are that you may want to use concrete words. Use single words, short phrases, and one-step instructions. Speak slowly and pause frequently. Emphasize key words when you speak. You want to use normal loudness. Give the person time. And use a communication book or board. Some strategies that we can use to help the person to express themselves include providing a communication board if it's appropriate for that patient or that person. Provide pencil and paper. Encourage the use of gestures, so that would be pointing and charades. Encourage them to slow down. Have them write the first letter of the word. Ask yes or no questions. Provide support. Don't pretend you understand if you don't. Now I'm going to pass the podium over to my colleague, Joanne.
All right, so Karen's done a great job of giving you all kinds of tips for both helping the person with aphasia or other communication disorder to understand what you're saying, and also for them to be able to express themselves, for you to help them to express themselves. But it's a lot of information, so I'd like to distill it down to a few things that you can try at home, starting right away. So first of all, think of it this way. When you talk, you need to add something to your talking. So as you're talking normally, you're going to add maybe a gesture. If you're talking about what it's like outside, you're going to possibly show a photo while you're talking to help orient them to what it is you're talking about. And you may write some key words, and I'll explain a bit more about that a bit. So in addition to adding something when you talk, if they're trying to tell you something, you can help by giving them something when they're stuck. So if they're trying to tell you something, maybe give them pencil and paper, because maybe they can write it down. You may want to ask them, can you write something to give me a clue? Can you write the first letter? You might have pictures for them to point to. So for instance, if your loved one has severe aphasia and they can't tell you what they would like to have for dinner, if you have pictures of what you might normally serve, they could point and tell you what they're interested in having. Or you could write out choices and give them written choices to point to.